many authors they have agreed, but my way is something different. Diabetes is a chronic disease associated with abnormally high levels of sugar levels in the blood due to the inadequate production of insulin or inadequate sensitivity of the cells to the action of the insulin. Everybody knows. So my calling to the world, you reverse the type 2 diabetes with nutrition, because the type 2 diabetes, where the plenty of insulin is there, but resistance insulin is high. So what are the nutrients which can reverse the resistant insulin to sensitive insulin? That is my focus. Along with our medication, I am not telling them stop all those medicines. The diet plan, the way of treatment. I started my way of treatment with my own diet plan, like zero polished rice. Again, I am writing polished rice. I never told black rice or brown rice. Zero sweets, zero sugar-based fruits. Even I stopped apple, pomegranate, banana, orange, mango, grapes, coconut water. Presume that 35% fructose, rest of the glucose. Stop jaggery, either pot rice or fattened rice, honey. Encourage any fish, 2 eggs per white, egg whites per day, 4 pieces of chicken, arugula. I will clarify what is arugula. That is a cruciferous vegetables. Whatever I told, all these things are diet or the food as medicine. I am my father being the father of medicine is Hippocrates. Hippocrates told that you take the food as a medicine and medicine as food. This is my aim of this whole management. So the top is the best calorie diet. Outcome of the diet plan. After giving those type of reduction of the medicine doses minimum to zero, sometimes with minor doses of medicine, it was emerging. I was puzzled in my mind that is anything wrong? Because 2 to 3 patients they come with the HbA1c previously 9.2 or 9.3. I have given it glimepiride, metformin, pyridoxal 1.5 or 1 and 1. After 6 months, they come with only 5.2. So I have to reduce the dose. Again after 6 months, they come with 5.5. After 2 years, I have to stop the drug. So I thought, am I in mistake? Actually, a little puzzled. Whether my machine is giving some wrong information. But I also collaborate with other machines. So, on continuation of the case studies in my research paper in 2015, Eureka, I got it. It was confirmed that through the clinical test. Thus, I declared that wrote about very low calorie diet, reverse the type 2 diabetes. So I prefer, because the age, the Indian, it is very difficult to get the brown rice and the black rice. That's why I prefer the wheat or chapati or roti. And I used to I preferred the chicken but not fried. I preferred the egg, not fried. I preferred the fish, not fried. Most important thing. Low calorie diet. Very low calorie diet generally contains 800 calories per day or even less. Author applied the diet plan to type 2 diabetes cases from 2015 to 2017 for both obese and non-obese variety. Out of 500 patients studied, the diet plan was 1 to 2 roti per day or 1 cup of rice. Not big cup, a small cup. 1 to 2 egg white or 2 pieces of fishes or 6 pieces of chicken plus dal plus green vegetables, 5 to 10 petals of garlic. I will later on what are the benefits of garlic. 1 onion per day. I used to take 100 petals of garlic per day. 2 cucumber per day. 2 tomato per day. 1 lemon per day. This is the main substance of it. That means I calculated. We have to give the diet plan within 800 calorie per day, 2 cups of coffee per day. You take the coffee not as a coffee, coffee is a medicine. Coffee is an insulin sensitizer. So I am telling all the people of the world, coffee not only is an anti-diabetic drug, it acts as the Parkinsonism, it increases the memory power, it reduces the fatty charge of the liver, it reduces the cirrhosis of the liver. Now the research study shows at 12 years, it also increases the memory of the small kid. So you see, these are the things, these are the food. I am saying no, these are not the food. This is anti-diabetic drug. So this is curry leaves. This is coriander leaves. So I used to train in the Indian here. That's right. Long. This is podina leaves. This is sprout, and this is onion like that.
Spring onions.
Yeah. So all these things, I am requesting all the people in the world, please tell your patients to take this type of things, plenty. These are not only reduces the diabetes, this is the anti-inflammatory action against the coronary artery. These curry leaves, if you take 2 months of curry leaves, minimum 100 to 200 grams per day, it can reduce the coronary artery. Now I have been invited as the Chief and Medical Advisory Board to the World Congress to be held in Bangalore. So my topic is I can reverse the coronary artery blockade. So I have also written one book on that, and it has, I hope the government of India is going to the highest medal for me. I have seen in my talk, my name was in the top, but it has not been declared. So again I am telling you, please prescribe these things to take too much of, because after 6 months you see, they reduce the drug. When the HbA1c come down to 5.5. So breakfast limited to 1 to 2 hours per day, idli mixed with the arugula. Arugula means those things I have told, this is the arugula. Arugula means this curry leaves, this coriander leaves, this long, this sprout, and this or insulin leaves. These are the arugula. So also called the salad rocket or garden rocket, it is a distinctive and delicious peppery flavor to soft green leaves and goes particularly well in the fresh salad, or half cup of upma vegetable or biri lentils or durum wheats or suji pitha, karela ka pizza, along with 1 avocado per day, or half hybrid guava, 8 almonds per day, 8 cups of coffee, 4 cups of coffee per day controls the diabetics perfectly, with or without medication. So now I am emphasizing these are the things which also are diabetic drug. You see the coffee is an insulin sensitizer. You see the Kerala, which also reduces the polypeptide, reduces the sugar. The ginger is an insulin sensitizer. This is the tomato soup, is also the low glycemic index, also insulin sensitizer. And here the fenugreek or the methi also reduces the carbohydrates. And cinnamon is an insulin sensitizer. And strawberry is an insulin sensitizer. Turmeric is an insulin sensitizer. Guava contains too much of fiber, which reduces it also insulin sensitizer. And this green chili. All these things are scientifically food as medicine. No side effects of diet include the fatigue, mild nausea, constipation, diarrhea, dizziness. I am with this of the diet plan for last 10 years. No obesity, artificial sweetener not recommended. 1 chapati per meal, 1 chapati has got only 80 to 110 calories depending on the size, but it has got 3.5 grams of protein, half a gram of total fat, no saturated or trans fat, no cholesterol, but it has got vitamin A, B1, B12, B3, calcium, iron and fiber. So I have allowed 2 eggs per, so 1 egg contains 17 calories, two fish, that is 97 plus 97. I used to prepare rohu or any sea fish can be taken. Our mistake is that small fish is good rather than the large fish. No, it is not like that. Only the difference between small fish and large fish is that the mercury level is high in larger fish, but otherwise everything is normal. So according to the, if you see the fish, the best fish in the simple water, no, not size, it is wrong. So most important fish is rohu, that is free water fish, or the, I prefer to prescribe the seafood. And skinless chicken breast, 110 calories, mixed vegetable, avocado, 160 calories, guava, almond, 10 nuts per month, and 1 ounce of Scotch whiskey I have advised. So there are several studies. First, Dodge study told that yes, it reduces the blood sugar. Now all the studies are showing 2 ounces per week will slow down the glycemic, it will affect the glycemic index. 1 chapati per meal. The effects of very low calorie diet. Very low calorie diet lowers the glucose production by decreasing the conversion of lactate and amino acids into the glucose, decreasing the rate of liver glycogen conversion to the glucose, decreasing the fat content, which in turn improves the liver response to insulin. This is a very key role. The above positive effects of VLCD observed in just 3 days. So I prefer these things. You see the Kerala pizza. Kerala pizza, don't take Kerala like raw Kerala. You can take it a Kerala pizza. And this Mediterranean diet good for type 2 diabetes. Application of VLCD approach. Using this approach, comprehensively we integrate the liver carbohydrate and fat metabolism. We showed that it is a combination of 3 mechanisms responsible for the rapid reversal of the hyperglycemia following a very low calorie diet. Application of VLCD, in my observation, only with a little dose of oral hypoglycemic drug can be achieved very good control of blood glucose. I have used in my study glimepiride, metformin pioglitazone, or in some cases voglibose, metformin with glimepiride, and few cases I have added teneligliptin. I have never used newer drugs or insulin. I have written this thing to Ada. Ada didn't give any reply to me. Then he requested me to